Hello guys, Dr. Shubhajit here. So recently many of you guys have been complaining of hyperacidity and there's burning sensation over chest after taking meals or lying down at night. And many of you guys have been saying that you wake up at night due to the chest pain or that burning sensation or the acidity. So today in this session we will know what we can do to prevent that from happening again and again. And if you guys are suffering from chronic acidity, you should definitely stick on to this video and we will discuss how to prevent with or without medicine. Okay, so first and foremost we must know why this happens. So there might be multiple factors behind this hyperacidity, but mostly due to our diet and our lifestyle, our sedentary lifestyle and very bad lifestyle, this production of acid in our stomach, it gets increased. Normally stomach is having some acid that it can digest food and kill some bacteria. It is for our own good only, but in certain cases if we are not leading very healthy lifestyle, this can lead to more excess acid production in our stomach. And also this excess acid in the stomach can come up through the esophagus or can travel up the esophagus, the food pipe. It should not happen because the stomach mucosa or the stomach lining is protected by several factors and mucus from the acid, but that powerful acid when comes to the esophagus, there is no protection to the esophagus and the esophagus get damaged in the long run, and which is not a good thing. It can turn into much worse thing in the future if not controlled. So whenever you get the symptoms, what you should do, the first and foremost thing would be, if you are getting symptoms, that means there is already some damage that is going on for a long time. That's the point where you should consult a physician and take the medicine and change your lifestyle. This is the right time to change your lifestyle and your diet before it's too late. So what lifestyle changes would you do to prevent this gastroesophageal reflux disease or GERD or hyperacidity in common language, what you call it? So the first and foremost thing, the lifestyle change that we should do is we should drink a lot of water. And you would not believe this, but water actually relieves a lot of hyperacidity. Water can actually dilute the acid in the stomach and prevent its damage to the stomach lining and the esophagus. So the first and foremost thing that you should do is drink 2.5 to 3 liters of water a day, regular basis. If you're not suffering from any disease, you're not having any kidney disease or heart disease, you can drink that much of water and your body will manage the rest. So you should definitely try that. Second thing, that you should actually avoid any kind of fast food, any kind of junk food, any kind of food that is rich in fat. And that is because fat content in the stomach will actually increase acid secretion from the stomach, and also it will keep the food for more time in the stomach. That is also more damage to the stomach lining because of excess acid secretion. So you should actually keep that in mind and avoid any fast food, any oily fried food in your diet for at least 1 or 2 months and see the changes by yourself. Apart from that, any kind of addiction that you are having, like alcohol, which causes gastritis anyway, and also smoking, that you should strictly avoid. These factors actually secrete acid more and also damage the stomach mucosa in the long run. And walk 30 minutes a day, just moderate level of physical activity, which is really helpful. And if you're obese, you should definitely reduce some weight, at least 1 or 2 kgs of weight within 1 to 2 months of period. That would suffice. Apart from that, what you can do is, while sleeping, while lying down, you can use extra pillow to elevate your head, that the acid cannot come up the esophagus. That makes sense, right? So that is the common sense thing to do. The food remains into your stomach at least for 1 to 2 hours. So after 2 hours of you dinner, the food will be leaving the stomach, so acid will not be there much. So take your meal and sleep after 2 hours. A moderate or light amount of activity is also recommended after taking your meal, like half an hour after taking your meal you can have a light walk. That is also helpful in emptying the stomach. Don't just lie down after taking your food. That is a very bad habit. And that's all. And there are certain food that you should actually avoid, like sugar. Excess sugar will increase the secretion of acid in the stomach. You should avoid sugar, because anyway we don't need raw sugar in our diet. We don't need any added sugar in our diet as per WHO. Avoid tea, coffee, any kind of spicy thing, onion, garlic, these things. If possible, avoid them too for at least 2 to 3 weeks. Just do that and see the change yourself. And once you get habituated to this lifestyle, you will feel the improvement in the symptoms. And if still you are not having the improvement, I would suggest you to visit a doctor and explain your symptoms, and the required medicines will be prescribed to you. Don't just go to a pharmacy and take some medicine for some short term remedy or something like that, because in the long run you need a proper treatment, proper diagnosis. Sometimes these gastritis symptoms might not just be a gastritis, it might be having some underlying pathology. For that you should visit a doctor. And that's it guys. So stay healthy and take care of your health. That's all I want to say. Bye, see you.